I'm Dr. Cynthia Lazzaro, and I'm the medical director of our Orange County clinic. So my path for leading into dermatology kind of goes all the way back to college. I actually didn't want to be a doctor. I wanted to be a lawyer. I studied politics at Berkeley, but as I kind of studied more and more about it, it just didn't seem right for me. And I was always good at science, and so I thought, maybe I'll try science again. And I took some classes and I did really well, and so I thought maybe going into medicine would be good. So what I ended up doing, I ended up shadowing quite a few doctors during this time period, and I happened to shadow a dermatologist. And during that time with the dermatologist, I thought this field was just so fascinating. In dermatology, you were able to see patients of all age ranges. You could see patients of all ethnic backgrounds and do surgeries. And one of the most powerful things I thought about dermatology was that with my own eyes, I could be a detective and figure out what was wrong with the patient and see them and then treat them and help them. I practice both medical and aesthetic dermatology, and I love both sides of it. On the medical side, I see a big range of things. I see skin cancers to rashes to lumps and bumps to acne, and it's all very exciting. And on the other side, I see aesthetic dermatology as well. And there's a huge variation in that field too. We do things like Botox and fillers and lasers, and that's equally as exciting. My approach to aesthetic dermatology is to try to help the patients look like a better version of themselves, because a lot of the times that's what the patients want. The patients don't want to look overdone or look like somebody else. When I do aesthetics on a patient, I want them to be able to look how they feel on the inside. And when aesthetics is done right, the patients will tell me like, oh yeah, nobody knew I had anything done, but they would say things like, oh, you look so rested, or you look like you just had a good night's sleep, or just came back from the spa or something. So I feel like when patients get that kind of feedback, that's when aesthetics is done correctly. What separates LaserAway from the aesthetic field are many different things. We have state-of-the-art technology. We have medical directors who are leaders in the aesthetic field, and we have strict protocols that everyone abides by. All of our clinicians have hundreds of hours of experience, and all of these things combined makes me very proud to have my name associated with LaserAway.
Like that video? Make sure to subscribe to our channel by clicking left. And for more awesome content, click right. To schedule your free consultation for any of our services, click the on-screen link. What are you waiting for?